All right, MCQ of the day, episode 12. The topic is going to be of CVS, heart murmur. So let's dive into the MCQ without wasting any time. 62-year-old man, old patient, progressive shortness of breath and decreased exercise tolerance for past 8 months. Okay, whenever the exam is saying this, that there is progressive shortness of breath and decreased exercise tolerance, you need to know that it could be a two system involvement. Either the CVS is involved or the respiratory system is involved. So one of these two systems is affected over here, okay, which is being tested. Okay. So he is becoming breathless while climbing one flight of stairs, fatigue by evening, no chest pain, palpitations, syncope. Medical history is significant for long standing hypertension that has been poorly controlled. What are the heart changes that happened in long standing hypertension that has been poorly controlled? I have posted it on my Instagram page. You can see the postmortem changes. I have posted the postmortem images as well. And हाँ, see the BP is very high. अभी इसके बाद में if हाँ, this is the most important, that on examination sustained non-displaced point of maximum impulse. Here you have to focus that the point of maximum impulse is non-displaced. What does it mean? It means that the heart has not grown in size at least. Abhi suppose if this is the heart, if I am drawing the heart over here, ठीक है, this is the apex, ठीक है. If the heart would have grown in size, dilated cardiomyopathy, the apex would have, the point of maximum impulse would have shifted. But here the maximum impulse has not shifted. So iska matlab examiner is saying that the heart at least is it having normal size. So there is no dilated cardiomyopathy. He is saying that there is no dilated cardiomyopathy. Now there is a crescendo, decrescendo systolic murmur best heard at the upper sternal border, ठीक है, radiating to the carotids. Now this is characteristic of aortic stenosis, murmur which is radiating to the carotids is characteristic of aortic stenosis. उसके अलावा the murmur is over here, ठीक है, upper sternal border पे he is saying. So there is this if you know about murmurs, you know about it, you read it, you know, ठीक है, this is aortic stenosis. Abhi, what are the other physical findings which are present? So we'll dissect option by option. S3. S3, when does it happen? S3 happens whenever there is volume overload. तो यहाँ पे volume overload है क्या? No, there is no volume overload since the point of maximum impulse is not displaced. If there was dilated cardiomyopathy, we could have got S3. S4 is the correct option because in aortic stenosis and also in untreated hypertension, what is going to happen is there is going to be concentric hypertrophy, which means that if this is the heart muscle is not going to go outside. This is not going to happen. What is going to happen is that if this is the outermost layer, now the ventricle is going to get thickened like this, ठीक है. Now because of this the ventricles will be very thick, and as soon as the blood, yeah, if I am drawing the blood in red, so as soon as blood starts filling over here, and as soon as this blood touches this stiff ventricle, it produces S4, ठीक है. Opening snap is seen in mitral stenosis. Wide and flick splitting of S2, this is seen in ASD, atrial septal defect. Loud P2 is seen in pulmonic stenosis, ठीक है. So the correct option is S4, ठीक है. अभी why is this S4? Now let me make some differences between S3 and S4 for you people, ठीक है. S3 S3 happens whenever there is volume overload, dilated cardiomyopathy. Whenever there is a huge volume filling up the heart is expanding, volume overload. Stiff heart, which is having a stiff muscles, and blood is touching against those stiff muscles that produces your S4. S3 is seen in early diastole, S4 is seen in late diastole. ठीक है, these few differences you have to know, but main thing is whenever the heart is having a dilated cardiomyopathy you see S3. ये S3, when do you see S3? You see S3 in mitral regurgitation, heart failure. ठीक है, S4 characteristic untreated hypertension, left ventricular hypertrophy in untreated hypertension, and aortic stenosis. This is what you need to know. Abhi, so this was today's MCQ of the day. Again, murmurs is a very huge topic. If you want me to discuss all of the murmurs, comment murmur in the comment box. If enough number of people comment, let's say at least if 10 people comment murmur in the comment box, I am going to make a complete video on murmur, break down each and every murmur, explain it in a way that you will never forget again. Alright, like, share and subscribe to my channel. I'll be back with more MCQs of the day. Bye bye.